be dangerous as far as the risk of cancer goes. But natural hormones are much safer, and they work in a more gentle way. Sensitivities, allergies, immune factors, and even neurotransmitters. We can do things naturally with supplements to increase the neurotransmitters that might help you deal with pain or relieve depression or relieve anxiety. You also can improve the receptor sites in the nerve cells, the membrane sites. All this we can do with integrative medicine. So we want to restore the balance, and this enables the body to function better, function more smoothly. A couple of years ago, there was proposed by the British Medical Journal, this is over in England, and what they propose is that we have the poly pill for people at risk. In fact, they suggested that they give this poly pill as a drug to everybody over 50 years of age. And what it would consist of is a statin drug, aspirin, a beta blocker, an ACE inhibitor, both the latter two are high blood pressure pills, and a couple other minor things. And they were going to throw it all into one pill and give it to everybody like you put it in your cereal after the age 50 to prevent heart attacks. Well, this kind of met with some excitement in the cardiovascular community, some skepticism, and some horror in the other fields of medicine, because think of how many side effects could multiply if you put all those drugs together, because all those drugs can have side effects, significant side effects that affect the quality of life. Now what I propose is, and this hasn't been published anyplace, but I propose you might get the same beneficial effect if you did polynutrient instead of polydrug. And that would include red yeast rice, which is good to lower the cholesterol, improve the HDL, very safe, much safer than statin drugs. Coenzyme Q10, which helps the muscles and the heart function. Fish oils, which helps clotting, reduces inflammation, reduces clotting. Vitamin C also reduces inflammation. Niacin helps with cholesterol. Folic acid, magnesium relieves spasms and helps with blood pressure. And vitamin D3, which we recently found out you're supposed to have 4,000 units of vitamin D3 a day. And you know, most pills at most will have 400 units. So in Ohio, we need those 4,000 units every day during the wintertime. Now, with days like we had today, you're going to make your own vitamin D, and you don't need it through the summer. But you probably could benefit from extra vitamin D. Yeah, you make vitamin D through sunlight. So if we did that with polynutrient, we'd probably get a much higher effect without the side effects as far as preventing cardiovascular disease. Well, why does integrative medicine work better than conventional medicine? In my experience, it certainly does. And I think that integrative medicine is a more gentle approach. Conventional medicine, when you think about it, it blocks actions of the body, it poisons enzyme systems, it cuts, sometimes it burns. You know, these are more violent. Yeah, and those things are cause side effects. You're right. So I think a more general approach is better. And one aspect of a general approach is lifestyle changes. And so conventional medicine is right on the money with that, except it doesn't put it up front. It just is kind of an afterthought that we do, you know, go ahead and eat and exercise right, but we really don't emphasize that this is more important, twice as important as any drug or surgery we could do. So integrative medicine uses multiple modalities to enhance normal function, and that nurtures the body, thereby reducing the need for drugs and surgery. Now, both integrative and conventional medicine can improve symptoms, but conventional medicine is much more likely to cause side effects. Integrative medicine, once in a while you can get a side effect from that, but it's not nearly as prevalent or as severe as the drugs do. Lifestyle changes have the greatest potential to decrease mortality and improve quality of life. So lifestyle factors are the core of integrative medicine, especially for cardiovascular disease. And virtually all physicians agree on weight control, healthy diet, Moderate exercise, not smoking, maybe a little bit of drinking. Integrative medicine seeks to improve function with stress control, much more aggressive with stress control, mind-body techniques, and interaction with the environment, detoxifying the body, balancing treatments. Practitioners with different skills help to facilitate improved lifestyles for their patients. Safety is a huge factor in favor of integrative medicine. And people who are not getting well using other techniques oftentimes do very well if they switch over and try some of the integrative techniques. We get a lot of the failures of the Mayo Clinic or the Cleveland Clinic. It doesn't bother us at all because the reason that those patients, they might have, if they went there and got well, they wouldn't be coming to us. But if they went there and they didn't get well, then what they did wasn't working for them. Or they weren't addressing the toxicity factors, the allergy factors, the diet factors. And that's what we do. And just by doing that, we can have great successes. The choice is yours. And of course, we also need to deal with big problems in our society. War, violence, poverty, pollution. Or our grandkids may not be around. So our practice in Bluffton is called the Celebration of Health Association. And I'm the physician that's there. I'm the only physician that's there, but we have 15 staff members, a lot of nurses. We have a naturopath, Bob Angus, who helps a lot on various aspects of what we do. My nephew is coming back in a few years to join us. He's at the University of Wisconsin right now, so we're looking forward to that as well.